According to a new report from the New York Times, the botched rollout of the nation's health care law was more than just a series of glitches. The report documents numerous deadlines missed by the agencies in charge of implementation and the contractors who did the work. According to the Times, the biggest contractor, CGI Federal, was awarded its $94 million contract in December of 2011. But the government was so slow issuing specifications that the firm did not start writing software code until this spring. As late as the last week of September, officials were still changing features of the website healthcare.gov. Now, Robert, even tackling this subject, problems relating to the ACA rollout, is, I think, difficult for a lot of people on the left because they feel like, oh God, we're going to give fodder to those on the right. But I think it must be discussed, and also the politics that led to some of these slowdowns are a very important piece as to why a lot of this has been messed up. As the Times says, politics made things worse. To avoid giving ammo to Republicans opposed to the project, the administration put off issuing several major rules until after last November's elections. The Republican-controlled House blocked funds. More than 30 states refused to set up their own exchanges, requiring the federal government to vastly expand its project in unexpected ways. It's almost impossible, though, for the White House to say, look, a lot of Republican governors wanted to make this harder for us, and it actually kind of became a little harder.
Can you imagine if we weren't obsessed with the shutdown?
Yes.
What would be going on healthcare? I mean, in fact, Republicans probably would be a lot closer to their goal had they not done that. But let's say that this is excruciatingly embarrassing for the White House and for the Department of Health and Human Services. This was bungled badly. This is not a server problem, right? Like just too many people came to the website. This is a website architecture problem. I think it is, again, it's excruciatingly embarrassing. It's not fatal, because there are still many weeks and days to go before the enrollment period closes at the end of March. I give credit to Al Hunt in his column today. I thought he had an interesting statistic that in the Massachusetts healthcare rollout, people came on average 18 times to the Marketplace website before they signed up for insurance. This is not iTunes. I hear a great album, I'm going to go buy it, boom, I buy it, and it's a one-time easy transaction. This is healthcare, and it's very involved. People are going to take their time with it, but boy, if they don't get these glitches figured out fast, people aren't going to come back for visits 15 through 18. And I will say this, I hope they're working day and night to get this done, and when they get it fixed, I hope they fire some people that were in charge of making sure that this thing was supposed to work. We knew there were going to be some glitches, right? But these are glitches that go, quite frankly, way beyond the pale of what should be expected.